Hi, I'm Simran Galhotra. I am a lung doctor, critical care doctor, and a sleep doctor. I was born in India, but at a young age, 11 years old, my family moved to Chicago. I grew up in Chicago, went to the University of Chicago for 10 years. I earned a bachelor's degree in chemistry. I got a degree in medicine, of course, and also an MBA at the same time. Then I actually took a break from medical training and I worked as a software developer. I'm self-taught in computer programming. Did that for about 4 years, but then went back to medicine. And at that time I was in the Washington, D.C. area. And I did all my advanced training in Washington, D.C. In pulmonary and critical care medicine. Then I moved to Payson, which is a tiny town way far away from the big city lights. But I've been in Arizona now for 15 years, in rural Arizona. I was in Payson for 9 years, and then I moved here in August of 2008. I feel like I can contribute a lot more than, let's say, in the big city where there might be, in Phoenix, where there might be 80 other professionals with exactly the same kind of training. Occasionally I'll send patients to the Valley for things that we can't do up here, but when those professionals send the patients back to me, they thank me for the kind of care that I'm providing up here and that the rest of us are providing up here. I've been able to improve the quality of life of tens of thousands of patients in the last 15 years. I'm not trying to boast. I'm just saying that I have made a difference, and I've saved several lives as well in the ICU. So that is what attracted me to medicine in the first place. Catherine, my wife, and I, we've been married more than 30 years now. We have 4 children. The oldest is 29, who had a baby boy 5 months ago. Our youngest is 13 years old, and she's in 7th grade. Our kids are here in the Blue Ridge School District. I have our second child, Lauren, is doing a chemistry degree at the University of Arizona. I'm learning a new programming language called Python right now. I'm taking an online course through MIT, and I'm learning Python. I work out 3 to 4 times a week. I have a personal trainer. I've lost, 30 pounds in the last year. What I find gratifying is that, a 50-year-old truck driver who has sleep apnea, snores loudly, and his wife has been elbowing him for several years now. Once I take care of that patient, help that patient take care of their sleep apnea with a sleep study and then CPAP, let's say, and he says, "Wow, doc, I feel so much better. My wife is happy. I'm happy." That's the kind of reaction that's worthwhile, makes it worthwhile.